Hello. Today I'm be talking about concussions in high school football athletes. Before I begin, a little bit about myself growing up is I've received two concussions growing up, and they were related to motocross incidents. I never understood how severe and what actually a concussion was. I always thought it was I just hit my head and now I have a headache. But a concussion is defined as a pathophysiological response to biomedical forces imparted on the brain, also described as a transient constellation of neurological symptoms that reflect a functional rather than structural injury. Clinical definition for concussions can be broken down into three parts: possible, probable, and definite. A possible concussion is most likely not the clinical presentation, although possible explanations can be identified. For a probable concussion, it's most likely the cause of clinical presentation. Other explanations exist, they are just deemed less likely. And for a definite concussion, it's the only explanation for the clinical presentation. Concussions happen each year. 1.6 to 3.8 million concussions occur during sporting events, and more than half of these are related to football. In recent data that was collected, concussions were in the top 10 most common injuries, rating at 9.6% in football athletes. Per 1,000 participating players, 2 will suffer from a concussion. When it comes to the knowledge of in high school football players about concussions, it was actually reported pretty low. Um, Not many knew the signs and symptoms and the significance and the increase of risk when you have a concussion. 25% indicated that they had never received any education at all, which is sad because that that's quite a significant number, and they are in increased risk for secondary injury and second impact syndrome, which can cause death. Um, the main signs and symptoms you're going to be looking for, the most common is going to be a headache. You're also looking for slow thinking, confusion, headache, emotional depression, anxiety, increase or decrease falling sleep time, and trouble falling asleep. When it comes to diagnosis and management for a concussion, the diagnosis is often impossible immediately after the incident occurs because signs and symptoms take several hours to develop. Um, these diagnoses of concussions are made on a clinical basis, and if a concussion is suspected, concussions assessment should be performed immediately. Most commonly, you're going to do an off-field evaluation using a SCAT-3, and they're not intended to be used the entire time during your sideline evaluation. If a concussion is diagnosed, they should not return to the sport for the remainder of the game. After 24 hours, if the patient is noted to have progressively worsening symptoms, a CT scan should be performed and they should be at the hospital. For treatment, you're mainly going to want to have cognitive and physical rest. You just want to make sure that they are not physically active and taking as much time off as they need. For high school, they have a return to play protocol, and they cannot start this until the patient is symptom free and is normal clinical examination and performs at an above pre-injury level function. The steps to this are light aerobic exercise, which is stationary bike, or mainly stationary bike for about 20 minutes. Step 2, sport-specific aerobic exercise, and step 3 is non-contact training drill. When going into day 4 and 5, day 4 is going to be contact training drills where they are allowed to hit, and day 5 is return to play completely. At any time, if symptoms occur during these phases, they should stop the activity immediately and restart 24 hours later. Additional treatment can be used. I found that massage techniques have worked on a few people, and it's used to treat concussions, and it has a supportive role in a person's return to function after a concussion. The goal of this treatment is they get a full body massage, and it's to facilitate musculoskeletal balance and reduce the signs and symptoms. Um, the length of care for this treatment, it's all depends on the severity of the concussion that happened. Um, this type of treatment still needs more research to better determine the effectiveness, but in the few patients they have used, it worked pretty well. For the massage locations, they massage the pelvic girdle, your cervical spine, your atlanto-occipital joint, and your atlanto-axial joint. And all this is to help create your balance back to normal and reduce all the signs and symptoms um, of a concussion. Um, the main thing of this presentation is just that I wanted to get a point across is that most high school athletes aren't aware of the signs and symptoms and how severe this can be. Um, it's not a joke, and it's is a deadly injury that happens, and it's seen all the time, and it's a very common injury in football. Um, so the main thing is just we need to make sure these athletes know the signs and symptoms and make sure they report them once they happen.